very brief overview of PHE for those of you for whom PHE might be a new concept. And then we'll have Craig and Mustafa talk about the Tuungane Project in Western Tanzania and what they've accomplished with their two organizations. If you have questions during the webinar, please feel free to enter them in the chat box. And then at the end of the presentations, we'll have plenty of time for Q&A. But meanwhile, I think all of the participants are muted while we're giving the presentations. So thank you for joining us. So for those of you who may not be familiar with population health and the environment, here is a brief definition. The PHE approach acknowledges and addresses the complex connections between humans, their health, and the environment. So the dots on this map mark PHE projects. As you can see, the majority of PHE projects are located in sub-Saharan Africa. Several projects began as early as 1993 and some as late as 2012. And starting in the 1990s, PHE projects were funded by a variety of sources, including private foundations such as Packard, Hewlett, and MacArthur. In the early 2000s, many foundations had to reduce their funding due to shrinking endowments, and USAID stepped in and increased their funding for PHE projects at that time. And USAID has been pretty much a very key supporter of PHE projects around the world since the early 2000s, when the U.S. Congress encouraged USAID to implement family planning in communities that reside around areas of high biological diversity. PHE is a community-based and community-driven approach that seeks to improve access to health services, especially family planning and sexual and reproductive health, while helping communities to manage natural resources and conserve the critical ecosystems on which they depend. And a hallmark of PHE is that it's a rights-based approach that really focuses on the communities themselves, and the communities often set their own goals and targets for what they like to achieve as part of the project. So you might be wondering why bother integrating population health and the environment instead of just doing single sector projects like what is done in most of the world. So PHE is really an excellent way to help remote communities develop. So first, integrated projects are cost effective for organizations and time efficient for communities. Second, integrated projects often lead to improved participation of men in reproductive health services and family planning, and of women in natural resource management and conservation. Third, family planning and conservation are often better received when they are presented with other benefits such as small income generation. Fourth, integrated projects can often reach the hardest to reach populations, or what we sometimes term the last mile populations in remote areas where people are often not receiving services from their governments or from other resources. And finally, PHE projects can be more responsive to the community's self-identified priority needs. So as I've mentioned, PHE projects include a range of activities. The population interventions often include family planning or reproductive health service delivery and behavior change communication. The general health interventions can include things like HIV/AIDS awareness, prevention, and treatment, comprehensive maternal and child health services, and water, sanitation, and hygiene improvements. The environmental interventions can include things like wildlife conservation and natural resource management, and establishment and protection of parks and natural areas, as well as components that focus on livelihoods and food security. And increasingly, PHE projects that are newer also include sectors such as climate change adaptation and building resilience. So I hope this brief introduction to PHE has shown that there are connections between men and women, their access to family planning, population dynamics, and the environment. We will now hear from Craig and Mustafa from the Nature Conservancy and Pathfinder International, respectively, about the Tuungane Project in Western Tanzania.
Thanks, Kristen. This is Craig Leisher from the Nature Conservancy again. And I'm going to start off and then hand off to Mustafa at Pathfinder International. So for the past 5 years, Pathfinder and my organization, the Nature Conservancy, have worked together on a project in Tanzania called Tuungane. It's not only an unusual name, it's also an unusual project because it simultaneously addresses population health and environmental issues. By the end of our talk today, we hope you'll have a better understanding of why population health and environment approaches were chosen in this area, how this approach contributes to international and national priorities, how the integration is done on the ground, and a bit about the results and the challenges that we found thus far. Next slide, please. So, as a conservationist, I'm partial to ecological maps rather than political maps. So here's a map of the Lake Tanganyika Basin showing where the project area is located. You can see it's the far west of Tanzania, and it's also at the center of a large lake basin. Next slide, please. So, why adopt a population health and environment, or PHE, approach in this area? Well, there's 2 reasons that I want to touch on, and they're intimately connected. Next slide, please. So here's the first reason. So the greater Mahale ecosystem is home to more than 250 species of fish that are found nowhere else in the world. And it's also home to 93% of all the chimpanzees in Tanzania. The lake itself is huge, and it's the 2nd largest lake in the world by volume. 17% of all the fresh water in the world is in this one lake. And it's also the primary source of protein and income for several million local people. So the project area is a globally important ecosystem. That's pretty clear, but here's the problem. The problem is the ecosystem is supporting a rapidly growing number of people. Next slide, please. So Tanzania's population will more than double by 2050. And while this may be unusual globally, it's actually not unusual in the Africa context. So this is a figure from a 2014 publication in Science magazine that uses Bayesian probability statistics to show the likelihood of different population levels by continent. So the red line shows Africa, and the confidence intervals is the projections, and you can see as the time goes out on the horizon, the confidence intervals get wider. But if you look at the dotted line that goes straight up the middle, that's where we're at today. And you can see there's about 1.1 billion people on the African continent now. So now look at 2050 on the red line, and you can see that there's a 95% probability that Africa will have 1 billion more people in 34 years. So while the population projections are steep in Africa and a bit steeper still in Tanzania, in the project area they're steeper than both of those. So in 2011 at the project baseline, the population doubling time in the project area was 14 years. So this means that every 14 years the population in the project area at status quo will double. And this has a lot of implications for natural resource use, because we know that most of the people in this area are heavily dependent on the forests and the fisheries around them for their survival and well-being. And we know that as population increases, the demand for natural resources increases. And if the forests and the fisheries are not well managed, you can have what's known as the tragedy of the commons, where because nobody manages it and everybody takes from it, it eventually collapses. But while skeptics may think that the tragedy of the commons is unavoidable, that is not the case. And there's a lot of examples where local communities have sustainably managed their natural resources for generations. And in fact, Elinor Ostrom won a Nobel Prize for showing this is true. So there's some pretty good reasons to think that if we empower communities to sustainably manage their resources by giving them the legal rights and the basic tools to manage these resources, we're going to have better outcomes for both people and nature. And more specifically, when we give people maternal and child health care and access to family planning, we know there's likely to be fewer births, and this in turn reduces the pressure on the local natural resources. And this is a critical part of what the Tuungane Project does. Next slide, please. So here you can see the cycle of how high population growth leads to environmental change, which in turn leads to food insecurity and limited land rights, a lack of education, young marriages, poor health, which continues the cycle of population growth and leads to further environmental degradation. So we want to break this cycle. Next slide, please. So at the risk of oversimplifying a large complex project, the Tuungane Project focuses on the 3 F's: families, fisheries, and forests. So let me tell you a bit about each. For families, the project provides access to basic maternal and child health services and to family planning services for those who want them. For fisheries, the project organizes villagers into management units to prevent the most destructive types of illegal fishing, especially using mosquito nets to catch the baby fish. For forests, the project helps establish community woodlots for firewood production and helps people farm more sustainably on the edge of the forests. And while we're doing one activity, we can do another as well. Here's where the synergies come in. So, for example, if there's a training of fisher folks on illegal fishing practices and what's acceptable, what's not, this is also an opportunity when we can talk to the fisher folk about the benefits of burst spacing. So there's some potentials that when you have a learning event for one topic, you can expand it to a learning event for multiple topics, because people lead integrated lives, and if we come at them with integrated messages, I think it's likely to have more resonance. So the project's theory of change is that if we take an integrated approach to PHE, then we'll have greater impacts than doing separate health and environment projects. In short, we expect to find what others have found with their PHE projects, that 1 + 1 + 1 does not equal 3, but 4, that there are some synergies. Next slide, please. There are other benefits that are worth considering as well. So directly or indirectly, a PHE project can contribute to almost all of the new Sustainable Development Goals. In Tuungane's case, by my calculations at least, the only SDG that the project does not contribute to is the infrastructure one. And in Tuungane's place, so rather in the Tuungane Project, it also contributes directly to Tanzania's national population policy, which emphasizes a multi-sectoral integrated approach with population dynamics and quality on one hand, and environmental protection and sustainable development on the other. In short, PHEs can offer a lot of benefits for the buck. Next slide, please. Let me give a bit more context to the project. So on this map you can see a black line that shows the greater Mahali ecosystem, and blue circles show the 24 villages where the project currently works. Now, we started off in 6 villages to the north and the south of the national park that you see here on the map, and then expanded to the other villages after a couple of years. One critical fact about the project area is that it's very remote, and many of the villages are accessible only by boats. And sadly, government services in the project area are minimal. So with that as the context, I'd now like to hand off to my Tuungane colleagues at Pathfinder International. Next slide, please.
Thank you very much, Craig. This is Mustafa again from Pathfinder International. Just to provide a little bit more context to what Craig was presenting, when we did our baseline study and, in the greater Mahala ecosystem, we found that the population was growing at 4.8% per annum, and that 49% of the population in the area was under 15 years of age. The contraceptive prevalence rate at baseline was 17% in 2011, which is significantly lower than what the national average was at the time. And when we did an assessment of health facilities, it showed that the staff in the health facilities were poorly trained, poorly motivated, away a lot of the time due to the remote location of the intervention area. Health facilities were in disrepair, and even the most basic equipment was missing. Now, just to give you context again to what Craig was saying in terms of the distances involved, in some of the lakeside-facing villages, especially the ones in south of the national park, it took women more than 24 hours to get to the nearest health facility if they had need for any emergency medical services. Now, on the conservation side, our baseline also showed that fish catch was declining, there was increasing sedimentation, villages were practicing slash and burn agriculture as they expanded the need for space, and there were many complaints and clashes in natural resource use between communities and conservationists. Next slide, please. So why PHE? And here's the reproductive health perspective, a little bit tying into what Kristen already presented about the benefits of PHE. The Tuungane Project works with people beyond the reach of normal health systems in remote and hard-to-reach areas. So from the health side, just to give you another example, when we went in 2011, it had been 6 years since any major district official had visited the project sites because it was just way too remote, vehicles couldn't reach them, and they did not have access to boats, or even if they did, they could not afford to pay for the fuel that is needed to get to the project sites. Since then, since the program has begun, there have been frequent, almost quarterly visits by district officials to the project sites. The other side is that implementation costs, particularly transport costs, are high compared to similar projects in urban setting. In the Tuungane Project, both Pathfinder and the Nature Conservancy share office costs, transport costs, and project staff from both organizations offer integrated service packages, which saves a lot of time for the communities. And as Kristen said, family planning and conservation are received better because we offer them with other benefits. There's greater involvement in natural resource management activities due to incorporation of the health and livelihoods component, and it is easier to reach hard-to-reach communities with reproductive health services by collaborating with the conservation organizations. Next slide, please. So this diagram explains, again, in a little more detail, some of the key interventions to generate the results we desire in the 3 Fs that Craig presented: families, fisheries, and forests. So in addition to the interventions that Craig very specifically mentioned that were specific to healthier families, healthier fisheries, and healthier forests, the project uses an ecological model to initiate changes in behavior at multiple levels. At the individual and household level, we support households to become model households, and these will be described in a little more detail later. At the same time, the project engages with local government at the village and district level to strengthen governance structures, ensure that village land is gazetted, and mechanisms such as district coordination meetings are put in place so that all relevant government divisions, fisheries, forestry, health, natural resource management, and others consider the issues and challenges facing the people in the landscape in the greater Mahala ecosystem in their entirety. Next slide. So here are some of the project results that we've achieved so far. Next slide, please. This slide shows the increase in the cumulative number of women using contraception in just the past 2 years. We estimate that there are over 31,000 women of reproductive age in the greater Mahale ecosystem. Of these, we have now reached over 10,000 clients, meaning that about 1/3 of women of reproductive age are now using modern contraceptives compared to 17% at baseline. 53% of these women are under 25 years of age. And there are many reasons for this increase in family planning use. 17 facilities in the catchment area and their staff have received infrastructure, equipment, and training support to increase the range of contraceptive methods being provided, both short-term, long-acting, as well as permanent methods. Community health workers have been trained to provide contraceptive counseling and methods through door-to-door services. Health workers also refer clients to health facilities, especially for long-acting and permanent methods, and in more remote sites help organize outreach services to reduce the distance clients have to travel to access services. Advocacy and engagement with the local government authorities has resulted in a doubling of staffing in all project-supported dispensaries and health centers. Next slide. In this second slide, we're showing that there also have been dramatic shifts in the number of deliveries in health facilities in just 1 year. Over 13,000 women have delivered in health facilities in the past year as a result of staff training on basic emergency maternal, obstetric, and neonatal care, the provision of essential delivery equipment, installation of solar lights and fetal Dopplers using suitcases from a sister organization, We Care Solar, in all 17 health facilities, and community health workers educating women and encouraging them to deliver in health facilities for better health outcomes for mother and child. One key area we want to emphasize on this slide is look at the rapidly increasing number, quarter on quarter, of the number of women delivering in health facilities, and that's actually a really great indicator of ensuring that both mother and baby survive during pregnancy and in the post-pregnancy period as well. Next slide, please. On the fisheries side, 12 beach management units have been organized with a total of 3,300 members. Beach management unit members patrol the beaches and prevent illegal fishing practices. They also clean the beaches and educate community members on the importance of keeping the lake water and beach clean for their own good health. The beach management units have confiscated illegal fishing nets worth $12,000 and have reached more than 3,000 community members with sustainable fishing practices. The project and the beach management unit members have demarcated 5 fish breeding sites in collaboration with the district council as well. Next slide. On the forestry side, village land use plans have been developed and approved at district level for 16 of the 24 villages. And these villages have now set aside almost 300,000 hectares as areas where wood cutting is not permitted. Villages have also designated community woodlots where trees are grown just for firewood. Villages have started patrolling the protected forest to stop outsiders from cutting wood in their forests. And perhaps most importantly for villagers, the project is training farmers on agricultural practices that reduce soil erosion and retain soil moisture. Next slide. On the integration side, this is just 331 model households have been established and are practicing positive population health and environment behaviors. This is a pictorial that we use in our education and outreach activities, and it shows a model household practicing many of the desired behaviors. There's a modern pit latrine, a key tool for preventing cholera. There's a tippy tap, no-touch hand washing station next to the pit latrine to break the oral fecal cycle. There's a fuel-efficient stove outside the house that uses less wood and reduces indoor air pollution. There's a separate drying rack for dishes to keep them clean. Animals are kept in a pen so their manure can be collected for fertilizer. Fish are dried on racks rather than on the sand so they can fetch a higher price. And there's terracing of farmland with a buffer strip of permanent vegetation along the edges. Model households also know how to access family planning options and commit to no illegal fishing. Families want to be model households because it gives them social status and recognition in their community. Next slide, please. On other integration results, over 66 microfinance groups have been established with over 1,700 people as members, and they've raised close to $300,000 in total capital. These community conservation bank members are using loans to establish small businesses like soap making, beekeeping, and selling of fish. And in terms of the governance area, 326 village leaders have been trained on good governance and using an integrated population health and environment approach. All villages are conducting quarterly community meetings and cover the PHE agenda during these meetings. We also have a very active community engagement process through sensitization meetings and the use of drama groups, and through which we've reached over 35,000 people out of a community of 105,000 people. I'll hand over back to Craig for the final slides.
Craig, I think you're on mute. Can you unmute yourself?
There we go. That'll be better.
Thank
Thank you, Mustafa. And I want to highlight some of the challenges that we found in the PHE approach. And these, when you hear them, you're probably not going to be too surprised. But the first one is that monitoring and evaluation in a PHE project is inherently more complex. There's just a lot of different factors that you need to monitor. And so, for example, we needed fisheries experts to measure changes in fish populations. We needed health experts to measure changes in reproductive health. And we needed remote sensing experts to measure changes in forest cover. All told, the Tuungane Project tracks more than 100 different indicators. So the PHE for, sorry, the M&E for this PHE project is both complex and expensive. And that may be an inherent factor with a PHE approach. Another challenge that we found is scaling up, and this one may be unique to what we're doing and the focus of the project in this area. But Pathfinder has been really good at expanding the reproductive health services to new villages. They've been able to scale up fairly rapidly. But TNC, in all candor, we've struggled to expand the project's environmental activities to new villages. Establishing a local group, for example, that has the legal right to manage fisheries and the capacity to do so, it takes willing leaders. It takes a district government declaration. It takes training, equipment, and most importantly, it takes a lot of education and outreach to fisher folks. So it's usually several years from the startup to the operation of one of these fisheries management units. And the simple fact is that we cannot scale up the fisheries and forests part of the project as rapidly as the families part of the project. So those are two challenges to keep in mind with a PHE approach. One that I think is common and one that may be more specific to Tuungane. Next slide, please. So we can't go into too much depth on this call with the details of the project, but if you'd like to learn more, I suggest you go to YouTube and search Tuungane, and there's a 3-minute video you can watch that give you a sense of what the place looks like, and you can see some of the activities on the video. And you can also go to either one of our organizational websites and search Tuungane, nature.org or pathfinder.org. So you can find out more of the details about what we're doing on these for this specific project. And finally, let me close with explaining that Tuungane is Swahili for let's unite. And that's exactly what this project does. It unites people in nature, it unites Pathfinder and TNC, and it unites the population and health with the environment. Thank you.
Thank you very much, Craig and Mustafa. That was really, really helpful. And as someone who visited the Tuungane Project area a couple of times early on in the project design stage back in 2011 and 2012, I have to say I'm really impressed and really excited to hear about all of the progress in the communities that you all and the project staff have achieved, and the communities themselves have achieved. Especially for me, it was really important to hear about the increase in the health facility deliveries and in the progress regarding forest conservation and the establishment of the beach management units. It's really impressive. So I thought while we're waiting for the any questions from any participants, so people who are participating, you can just type your questions into the chat box and then we can answer those as they come in. And then also there's a handout that you can download either now or after the presentation ends. And we'll also send that out by email when we send out the recording of the webinar, but feel free to download that now. So while we're waiting for questions from the participants, I thought we would kick some things off with some other questions. So the first one is, why did Pathfinder and the Nature Conservancy decide to work together in Western Tanzania? What about this region made it really compelling to do a PHE project there?
I'm happy to take a first cut at that, Mustafa, and then please jump in and add. So we had a shared donor who both gave to TNC and to Pathfinder, who encouraged us to think about potential partnerships, because we at the Nature Conservancy were focusing more and more on the people side of conservation. So we looked around for a suitable site and found this one in the far west of Tanzania. And then this donor who helped, who gave to both organizations, put up some anchor funding to get the program started. And we've been very successful since then with maintaining the funding for it. So, Mustafa, anything to add?
I think, Craig, you captured it well. And I think more importantly, once the decision was made that TNC and Pathfinder would be finding a way to partner together, for Pathfinder, the indicators, we already had a good idea of where the greatest needs were for reproductive health services, and the indicators in the Kigoma region, where the greater Mahale ecosystem is mostly situated, were extremely compelling, and so that formed a strong basis for determining the choices we made with you. Thanks.
Thank you. And then I'm curious, Mustafa, if you could talk about how and why Pathfinder decided to embrace PHE as part of the organization's mission and how that came about.
So it was a long journey, but I think the key issues that are driving that drive the decision for Pathfinder can be summarized as follows. There's a very deep commitment within the organization to ensure that services are available and delivered everywhere, and that women and men everywhere have the ability to access services, good quality services. Now, when we were reviewing that, we recognized that people living in very remote communities, and typically people living close to conservation areas tend to be living in very remote areas, tend to be forgotten. While we may be good as reproductive health organizations at reaching very remote, reaching scale, that scale comes at a price of not being able to reach remote communities. So it was important for Pathfinder that we engage with remote communities and address the issues that they face, the reproductive health issues. But at the same time, there was a very clear recognition that we couldn't do that and just go in with reproductive health services, that we needed to be able to address their needs from a broader perspective, and look at all their development needs as a whole, including the conservation element. A second piece, a second larger argument that we'd like to make is that for us, it's also very critical that we create spaces as a reproductive health and rights organization for women and girls to be able to better engage in the change processes that affect them. We typically work in contexts which are very male-dominated, and we need to have ways to engage them. And in areas as remote as the villages in the greater Mahale ecosystem, it's very clear that women are spending so much of their time either being pregnant or raising children or doing both and then growing food to feed the family, that they have very little time left to actually engage in civic processes. Through a PHE approach, we see that allows us to enable women to better engage in the processes that affect them as well.
Thank you. I'm curious if each of you could tell a story about a person who you've met in the project area who was positively impacted by the Tuungane Project. Craig, do you want to go first?
Yeah, sure. So I want to talk about Richard, who is a fisherman in the village of Bahingu. And so he has benefited from the beach management unit, as they're called locally, that organizes fishers into a cooperative that regulates their local fishing grounds. And they have the legal right to do so. So what's happened for Richard is that once they've been organized to where they've stopped illegal fishermen from using mosquito nets near the shore, they're seeing that there's more fish in the offshore areas. So in this project area, the primary fish is a small sardine-like fish that just has about an 8-month lifespan. So it doesn't take long for these fish to grow, and they have tremendous number of offspring. But if you fish these offspring, the little babies, in the nearshore areas with the mosquito nets that pretty much every household has, yes, it makes a pretty good soup, but you jeopardize the longer-term fishing in the area. And so Richard has seen his fish catches increase over the years since they've outlawed the illegal nets in the project area. Thanks.
Thank you, Craig.
I'll actually hand over to my colleague Helen Magige, who will share a story as well.
Yeah, I recently went to Mahale and I met a family, Raymond's family. And what really amazed me when I just went to their house, she was coming from clinic with a small child, like 2 years, and he was just alone. And I asked him, why? Where is your wife? And he said, oh, my wife went to, she's doing business, so I have to help her to bring our child to clinic. So that was very interesting. And when we just sat in his house and he called the wife, and what they told us is first that he was coming from Zambia, and when he arrived in Mahale, in Buhingu, he didn't have anything. But then he joined with Kokoba, and after joining in Kokoba, he got some loan from working there, and then he even started tailoring business, and he didn't have a house. He was renting a house, and he managed to build a house with his wife with the saving they received from Kokoba. And the house was one of the model household, which we said, because he had all the criteria, like toilet, a good house. They were using family planning. They had 3 children. And what he really said was that without Tuungane, without Kokoba, I wouldn't have been here. And he was very thankful for the project, and he's one of our role models. Yeah.
Thank you, Helen. So I'll start with a question from the audience. So someone who works in Madagascar is curious to hear a little more about the model households and whether or not those are celebrated within the community. And also, how many households are there in the project area? You all mentioned that there are 331 model households. So how many total households are there in the project area? And how are they monitored and classified? Thank you. I don't know which one of you wants to take that.
Craig, Evodius can take the question on the model household, if you're okay with that.
Sure, perfect.
Oh, sure. All right. Welcome, Evodius. Hey, introduce yours. No, let me have the pleasure. So, Evodius Ruta is the M&E person at Pathfinder who focuses on PHE projects. And Ruta and I have had the pleasure of spending some time in the project area doing surveys. So, welcome to the call, Ruta.
Great. So, the model household basically, it's like what Mustafa said, it's a behavior change campaign to promote positive environmental, health, and conservation behaviors. And the way the model household approach works is the project first introduces the concept through the village assembly meeting to make sure that village members and community members are sensitized, are informed about what the model household is. Then after that, the project staff and the community agree to develop criteria for a good model household. And we have developed about 22 criteria. And one of them is a good model household must have a pit latrine that has a cover. Another criteria is a good model household must also use an NH7, wood NH7, so that use less firewood and charcoal. And through that, we have also trained what we call model household motivators who visit each household in a village, no project villages, to encourage and to promote village members, community members to join the model household. And as of now, as we are talking, we have 331 model households that have been developed by the project. And many people are adopting these model households because they bring in a lot of benefits, not only to the house, but also to the community members.
And the second half of the question was around how many out of the total, and that number is...
I think it will be, we will have maybe about 6,000 to 7,000 households. And we are still, after 1 year, we have about 300 households. And the main reason really is that it takes a long time. We have realized it takes a long time to develop a model household because some criteria, for example, which we have, like having latrine. Some of the households didn't have a latrine, so they have to do saving to build a latrine or energy saving stove. So what we have done is we changed our model and we are using more community members to support establishing more households. So we feel that we will move, like for this year, for next year, we are planning to at least have additional 1,000 households because we are changing the criteria to enroll more households in this to become model households.
And then what's interesting, maybe if I may jump in very quickly, so it's a slow start as we're learning what it takes to establish the model households, but we're also, speaking of integration, we're bringing in examples from on how you rapidly expand new practices from Ethiopia and Malawi, where on the health side, they've used this model household rapid 5-household approach to rapidly expand the number of households. So every champion manages to get 5 households to adopt model household behaviors, and then those 5 households, once they've established their model behaviors, will be asked to expand out and reach another 5 households, and through that a strong developmental process gets put out, and one that's more sustainable as well. So it's interesting that we're also learning and bringing in ideas from the health sector into the PHE sector as well.
Thank you all very much, and it's nice to have Helen and Ruta join also. So Beatrice has a question for Pathfinder for when you first enter a community and you're going to do a PHE project, what's the starting point as a as a traditionally health-focused NGO, what do you say to the community as to why you're taking this integrated approach?
That's a great question, Beatrice. It's a tough question. It's one we've been asked before. I think the advantage we had was when we first entered both Leisher Conservancy as well as Pathfinder, we approached the communities through and in collaboration with another organization, conservation organization, that had already been working in those communities, the initial communities, for a good 5 years before we came onto the scene. And that introduction led to a tremendous amount of trust in the community. Now, having said that as well, in new communities where there wasn't the same process established, what we do is we work very closely with the local government, and starting at the district government, engage with them, let them know that we're coming in with a program, develop the guidelines with them, and then with them go to the different villages and make sure that we introduce the project to the village leaders, letting them know why it's integrated and what the components are. And then that allows for that entry process to begin as well. But when we do that, we don't go in saying Pathfinder is going in on its own and Nature Conservancy goes on its own. We haven't done that. What we've tried to do as much as possible is go in as a team to introduce them. So even recently when we were introducing some new staff on the health side into the program, the introductions weren't made just by the Pathfinder team. The introductions were made by Nature Conservancy and Pathfinder staff to the villages. And that allows them to see us as approaching the village as one program, not as Pathfinder or Nature Conservancy. In fact, would be hard put if we went to the villages. I think many of them would not know that behind the Tuungane Project are Pathfinder and Nature Conservancy. We've branded, all our staff are branded as Tuungane staff, and they go in with one voice working on multiple issues in the community.
Thank you. Yes, I think that is a key aspect of the project, that you are kind of one project and people don't see you as two separate organizations working together. Another good question from Karina is about engaging local decision makers. So often local decision makers like the county council and village elders, want quick gains for their communities rather than longer term impacts. And as Craig mentioned, sometimes the environmental aspects of PHE projects take longer to achieve. So she's wondering if we could get some insights from you all on how you engage the local decision makers to see the value of longer term impacts, or do they already see that, and is that not an issue in the Tuungane Project area?
Craig, do you want to start with the response, and then Helen, Evodius, or I will jump in?
Sounds good. So what we've done is structured a series of short-term benefits and then the longer-term benefits. So local decision makers can see pretty quickly what kinds of benefits the project is giving the people in their areas pretty quickly. And around the health issues, we were able to refurbish the clinics, get them adequately equipped, and make sure that they have adequate supplies on hand. So those things are pretty tangible that people can see that happen early on. I mean, we also have established a number of micro savings groups. These are village savings and loan associations that have been widely used in many different countries. And here we know that within about a year to 2 years of the people that get loans from their groups have benefits that are tangible. We've measured an increase in income, for example, among members of these village savings and loan associations. So that's something else that local leaders can hear about, and they can come and visit these groups and see how they're doing. And I think all told, the project has 66 of these groups that are now operational. So that's quite a bit. Almost all of the, certainly the original villages all have these village savings and loan associations, and now we're rolling them out to the newer villages. So those are sort of some of the shorter term benefits. In the longer term, we're hoping that being able to organize people to better manage their resources, which takes quite a few years, will start to show the benefits of having a sustainable firewood supply, having sustainable fisheries, having better water and sanitation in the villages. Those kinds of things that take more time, that we hope that the local leaders will recognize that they're coming, and some of them have been, some are already evident, but some we still need a critical mass to see the benefits. Thanks.
Thank you both. So we have another question from Elliot about the challenge in linking access to contraceptives with environmental outcomes, and how does healthy spacing of children affect the forest or the fishery? So if I may, I might take a stab at answering this one. I remember visiting Tuungane, I think in 2011, and talking with a fisherman who had 6 children, and his wife had been pregnant with their 7th child, and she had obstructive labor, and the wife died and the baby lived. And so then this fisherman had 7 children that he had to take care of on his own. And so in addition to doing more, kind of desperate fishing practices in order to feed his family, he then was spending time, cutting illegally in the forest and doing harvests in order to try to get a little bit of extra income for his family. And so I think that's a very compelling example of how, if he and his wife, when she was alive, had access to family planning, if they had wanted it, and if they had been able to space their children, they may have had fewer children, they may have had healthier children. If the health facilities were functioning, and if the woman had been able to access good health facilities, she might have given birth in a health facility instead of in their home, and she might have lived. And then, they could have been better able to provide for their family. So I think, for me, that was an example of why the project is compelling, because the fisherman then resorted to both more destructive fishing practices and forest practices in order to provide for his family, because he was more desperate to do so. So we have about 5 minutes left, 3 minutes left. So we can take one more question. So hi, Natalie. Natalie and I used to work together in Madagascar, and we wanted to ask a quick question. She wanted to ask a question of an example of an indicated indicator that the project is using. So Craig, do you want to give an example of an integrated indicator? Sorry.
Okay, I was going to ask for a clarifier. An integrated indicator, yes. So the one that we're using most is the number of model households, because in order to become a model household, you have to have elements in forestry, fisheries, and families. So it's part of the criteria to be a model household, that you're doing something in all 3 areas of the project. Another indicator is the membership in the village savings and loan associations. So in order to be a member of the village savings and loan associations, you have to be a member of your fisheries management group. So it's one of the benefits of joining the fisheries management groups, is you then have the opportunity to join one of these village savings and loan associations. So that's another indicator that we track. Anything else, Ruta or Helen, to add to that?
And they're having some bandwidth.
Yeah, I'm going to try, and let's see if it cuts out. Let me know if it's cutting out, okay?
Okay, you sound fine.
At the danger of speaking out of turn in front of 3 M&E experts, Craig, Evodius, and Helen are all monitoring in evaluation experts. I think that the other way we measure integration is to look at issues around governance, looking at the engagement of the village government in issues around PHE in general, and the extent to which they're engaging in these issues, but at the same time looking at the extent to which women are participating in decision-making processes. And when we say women's participation, it's not just about the number of women who are part of the village governance structure. Well, that's an important criteria. But then the second criteria is the extent to which they are then they have the space to be able to actually make their contributions and their contributions counting. So that's a harder indicator to follow, but it's one that we're beginning to really try and capture in the program as well.
Thank you. And then Mary from JGI was wondering if there are any other organizations in Tanzania integrating PHE. So I know the Jane Goodall Institute has done a lot of PHE work in the past. Craig, do you want to talk about NTRI really quickly, and then we're going to wrap up?
Sure. So there's a recently started project in northern Tanzania. And just like the Tuungane Project, this one is an ecologically very important area. It's a huge area. It's home to the second largest animal migration in the world. And it's called the Simanjiro Plains. And it's a Maasai area and along the border with Kenya in the north of Tanzania. And here we've got a large project, $12 million over 5 years with USAID funding. There are 9 partner organizations, but it's we're just getting it off the ground. We don't yet have the funding for the health activities, but we're expecting it to become a PHE project. That's the intent within the next year. So it'll be doing many of the similar kinds of activities as we did in Tuungane. It's again the same couple of partners in Tuungane with Pathfinder and TNC focused on much of the PHE work, but then we have a number of local organizations and even some international ones that are partners as well. And it really scales up the PHE approach to not just focusing on a handful of issues, but we're probably doing, I don't know, 20 or 30 different issues in this entire geography with a lot of specialized organizations that have particular skill sets in things like human-wildlife conflict, counting the number of large mammals in the area, how to reduce elephant crop rating, for example. So there's some highly specialized skill sets that these partner institutions are bringing that we hope is going to give a yet more integrated approach to the problems people are facing in this geography. Thanks.
Thank you, Craig, and I just want to thank everyone for joining the call today, and especially to Craig and Mustafa and Ruta and Helen for helping answer questions, and to all of the participants who asked very good and very challenging questions. And just a reminder to download the handout that has extra resources that you all can access related to PHE, and also to join the Africa PHE list in order to get monthly updates, and that email address is africaphe@prb.org. Again, africaphe@prb.org. And if you have ideas for future webinar topics, please send them to africaphe@prb.org, because we intend to do these on a quarterly basis. And this webinar was recorded today, so you can share it with your colleagues. And finally, you can also follow Africa PHE on Twitter and Facebook if you are so inclined. So thank you all again, and enjoy the rest of your day and evening.
Thanks, Kristen.
Thank you, Kristen.
Thank you all.